Welcome. My name is Valerie Wood, and I'm your instructor for Clinical Assessment and Diagnosis II. I'm here to offer you a little bit of an orientation to this course and to tell you a little bit about me and my background. I'd also like to give you some of my thoughts on assessment and diagnosis. As you begin this course, I'd like you to consider the following in your work: assessment, diagnosis, treatment. This is the foundation from which I would like you to build each case upon as you begin this work. In the DSM-5, its collaborators in the use of the manual write about clinical utility. They emphasize the importance in utilizing diagnosis to determine prognosis, treatment planning, and potential treatment outcomes. As you work through the content of this course and construct diagnostic workups, it's important to keep this in mind. We strive to be diagnosticians who are client-centered in our assessments and treatment-focused. In this class, you won't be developing treatment plans nor construct implications for treatment in your cases, but treatment begins at intake, and we don't leave that concept in the dust because it won't be on the final. It won't be on your exam, but it will be in your work, in your practice, every day, with every client, in every session. Now back to me. In addition to this course, I'm also a field faculty advisor at Fordham. This affords me the opportunity to participate in the process as you take the skills we offer in the classroom and develop them into practice behaviors. I've benefited to see my advisees develop into competent, confident social workers who've earned the respect of their colleagues. And in your advanced year, I look forward to working with you. Prior to coming to Fordham, I was with another graduate school of social work. There, I taught courses, Practice 1 and 2, Psychopathology, which is the equivalent of your Clinical Assessment and Diagnosis 1, Integrative Seminar 1 and 2, and I also was field coordinator for the Northeast region. That was also an online program. Prior to that, I taught undergraduate, primarily sociology courses, but also psychology and some political science. In my clinical career, I spent a lot of time in crisis intervention. I was with Domestic Violence Agency working on a hotline for a while. Then I spent 7 years with a suburban hospital in crisis intervention doing screenings. Crisis intervention screenings are unique. You assess risk, mobilize resources, stabilization, and then referral. Diagnostic workups are sometimes only 30-45 minutes. And then you need to construct a case formulation with very little information, sometimes with no collateral information, and then get a pre-certification from an insurance company where they're looking for diagnosis, treatment plans, and sometimes even aftercare referral information. Following that, I went to an inpatient substance abuse facility in an urban setting. They also had outpatient care there. My role there was senior clinician, and I supervised master's level clinicians. I specialize in co-occurring disorders. I currently specialize in substance abuse and eating disorders. We found that, and this isn't, we didn't discover this, I mean, this is common knowledge, but when treating substance abuse clients who have co-occurring disorders, those who chronically relapse and just can't get clean, finally, when we treat the co-occurring disorder, have an opportunity to actually recover. Following that, I was with a suburban mental health agency as clinical director. There I supervised clinical staff. Many of the clinicians were unfamiliar with the DSM-4, and that was a real challenge. There I also did program development, strategic planning, and board development. Following that position, I went to the University of Southern California. I mentioned what I did there. Then I focused on my private practice for a while, and I've had my private practice all along throughout the years. I've maintained that since 2005. Most importantly, my greatest accomplishment, I have 3 teenage boys. One of them is now a sophomore at George Washington University. I have one who is a sophomore in high school and a junior in high school. My guys are the best. The curriculum for this course is outlined in your syllabus. This is our contract. That's posted on Blackboard. I'd like you to spend a lot of time with it, read it, and contact me immediately if you have any questions. We have 2 quizzes for the course, 1 final exam. You will get a review for the final. You will be doing a diagnostic formulation. You'll also be reviewing some cases. This diagnostic formulation is not on the syllabus, and I'll help you with it. I'd also now like to talk with you a little bit about the organization of the content of the course. Dr. Elaine Congress created the design and the content. She did a fabulous job. I'm not really going to change much of it at all. I'm just going to add to it. She's recorded the introduction to the modules. Her style fits really well with the content that follows. In the first one, in the introduction module, you'll hear that she's the instructor for the course, and she is, but not for this particular class. I will pop up in videos from time to time. I'm also going to hold class meetings online. These are not required. You don't have to attend these, and they will be recorded. I'm also going to hold office hours regularly, and I'll post these shortly. I will be available to you as you need me. You'll be seeing enough of me, believe me. So now it's your turn. There are instructions posted for you to offer us something about your background, to tell us a little bit about who you are and what your expectations are for this class. I'd like to hear about what you're going to be doing in field this semester. So here we go. Fasten your seatbelts. This is going to be quite a ride. I'll see you soon. Bye.